Hey everybody, it's Dr. Langdon, and I'm not in the mood tonight to tackle some of the deeper topics that I'll try to eventually. So tonight, I wanted to give you a little insight into what it's like in the life of a medical student. I have made this one comment before, but it's still so true, and I get tickled. Uh, we spend so much time teaching students the vocabulary of medicine, and it is its own language with lots of intricacies, lots of new words, things that don't even always seem like they make sense, but we don't always evidently teach them how to pronounce them properly. But no, the irony is that then when they have to do an OSCE, if they accidentally use what we call medical jargon, they can have points taken away from their humanistic rubric, which seems kind of unfair when we're filling their heads with the knowledge of all this vocabulary. Well, anyway, recently, the students have to take so many different kinds of tests and exams, but one of them in clinical skills lab, not only do they have to do OSCEs and do they have to do simulations for which we grade them as well, but they also have to do literally an exam on the physical exam. So we were recently having the practical exam on the physical exam practice. And so faculty will walk through all the students, and they're sort of take turns with one student's the doctor, one student's the patient. And I just overheard some funny words. So you may not know this, but there's a word called a bruit, and it means when you have, some sort of turbulence in the flow of a large vessel, an artery, you can hear a little bit of a sound there of that turbulence. And you would listen to that with the bell, not the diaphragm of your stethoscope. So you've probably seen maybe your doctor's place the small circle part of the stethoscope over your carotid arteries to listen for a bruit. Well, that word happens to be spelled B-R-U-I-T. And I passed by this group of students. And of course, in these normal healthy people, they shouldn't actually hear any of these bruits, but they were worried because they couldn't find any on physical exam, any bruits. It was so sweet and so cute. So that's pronounced bruit. Also, it was cute. One of the exams for if somebody has appendicitis, if the patient's lying down on their back and you sort of push down on their right lower thigh above the knee and say, can you lift your leg, please? But you're pushing down, so they're pushing up against you, and that would hurt because it would be using the psoas muscle, and that is spelled P-S-O-A-S. And I walked by a table and heard someone saying, okay, now we're going to do the psoas test. That was cute. And then what was the other one that we heard? Oh, this one was great. Sometimes if a patient were to have, usually liver failure, but a few different causes for fluid inside the actual abdominal cavity, it's called, well, let me tell you how the word is spelled. The word is spelled A-S, and then C-I-T-E-S. And I passed by a table and I heard a student say, oh, we need to do that test, which is like shifting dullness. And anyway, we need to do that test for ascites or ascites. It's ascites, A-S-C-I-T-E-S, ascites. And then once when I had a student, I was precepting a student in clinic, I've heard a lot of funny things there too. And they were trying to describe to me a rash that was red, which is just, erythematous, an erythematous rash. And they said arithmetic. I had never even contemplated that pronunciation. It's erythematous. So just know those students are working so hard, and they are precious and brilliant and exhausted and stressed. So pray for medical students and appreciate what your physicians went through back in the day. Thanks.